Hi friends, today we are going to see the second part of composites, as we have three parts. So I am covering composites in three parts. Okay, overall in brief I am covering, and if you combine all the three videos, it will be a sum up of the composites, and you can very well write your university essay. Here we are going to see the classification of composites. First of all, resin composite is classified based on restorative procedure as direct and indirect, and filler particle size, macrofilled, microfilled, hybrid, model hybrid, nano composites. On clinical applications, packable, flowable, polyacid modified, self-adhesive, osmotic, bulk fill. Curing modes, chemically activated, light activated, heat cured, dual cured. And then based on the sizes, and in this video we will see in detail about the sizes, and this is very important. You have to mention them in the exam, and you should also draw this diagram in the examination to fetch more marks. Here we have macrofill, microfill, hybrid, nanofill, minifill and medifill. So based on the sizes, we have various types of composites. So this comes in advancements. Flowable resin composites, in which conventional flowable, self-adhering flowable, bulk fill flowable, core build-up flowable and bioactive flowable. So in which this order the trend goes up, that is, it's becoming more modern. So let's get to the points, that is the classification of composites. Conventional composites, if we see the conventional composites, you have a size of 8 to 12 micrometers. If you see that it's a very small size, but still in the different types of composites, this is the largest size, which means there are sizes which are lesser than them, which is lesser than 8 to 12 micrometers. So this is the largest filler size, and this has high strength and hardness, so it has a good physical property. And then it has less water sorption, which means the tendency of the composites to attract the water is lesser, and coefficient of thermal expansion is also less, which means composites, when under a heat or a kind of warmth generation, what happens is a kind of expansion takes place in the composite, which is not actually fair enough, which may lead to micro leakage and carries, that is the secondary carries. So in these kind of conventional composites, the polishing becomes difficult, and it basically results in a rough surface that tends to stain. So these composites are not used much nowadays. These are not preferred nowadays. Nano-filled composites are majorly used. Then comes the second one, that is the microfilled composites. So here we have the smallest filler particle size. So what we have to know here is the filler particle, the largest size of the filler particle is not good for use. The smallest of the sizes of filler particles are also of not much good use. Let me tell you why. Colloidal silica is used as filler. So basically, what are fillers? So I have to tell, most of you might have known, but let me tell that fillers are something which connects the polymer and the monomer. It's just in between, it is present in between the polymer and monomer, and majorly fillers are used to reduce the shrinkage of the composites. So basically that is why fillers are used. So these microfilled composites have the lowest filler content of 50% weight. So due to that, they have lowest strength and hardness. This is why I told that this is not good for use. At the same time, they have a high, they have in fact the highest thermal expansion coefficient, and they have a high water sorption. So you may ask me why water sorption becomes a problem. Water sorption is absolutely a problem because composite requires the highest level of isolation. Without isolation, the composite is going to fail. Why? Because what happens is, when we do not do isolation, the water gets inside the composite and it comes between the dentin bonding agent and the composite. So dentin bonding agent is something which fuses composite with the teeth. So the resin tag formation and the bond between the composite and the tooth becomes weaker. So that ultimately the restoration is not going to last for a long time. It's going to fail. So that becomes a major problem. So microfilled composites are not much used. This is the reason why they are not much used. They have excellent aesthetics and smoothness. It may be really better than all the others, but still they are weak and they have many other problems. So the next type is small particle composite. Filler particle sizes 1 to 5 micrometers, a little bit larger. They have good surface smoothness, and at the same time they have improved physical properties like the conventional composite, which means they are a bit harder. At the same time they have good surface smoothness. So that makes the small particle composite superior to the conventional and microfilled composite. They also have a high compressive strength, but still hybrid composite and nanofilled composites are better than small particle composite. Let us see why. The filler particle composite, that is the hybrid composite, is of a little bit lesser than the small particle composite, that is 0.6 to 1 micrometers. They have smooth finish and better aesthetics. At the same time, they have the similar physical properties of the conventional composite. They have smooth and better finish and a good aesthetics compared to small particle composites. They are better than all the types. But yet, they also have a good physical properties. So we have an advancement from here, that is the nano composites, which are even better than hybrid composites. They have filler particle size lesser than 0.6 micrometers. Okay, that will complete the filler particle size classification of composites. And to briefly see about the chemically activated and light activated composites. So basically they are classified by the type of curing. So that is how they are classified here. So here we have in chemically activated composites, we have two pastes, the basic paste and accelerator paste. So how does chemically activated composites act? So here we require a particular kind of chemical in which the composite is going to get activated. So by the reaction of the chemical, the composites get activated and then they get cured and they harden. And then the restoration is, and then we can finish and polish the restoration. So to briefly tell about the chemically activated composites, it is just like that. The basic paste has benzoyl peroxide and tertiary amine as activator, N-dimethyl paratoluene. Light activated composites, these are the majorly used day-to-day composites which we use majorly, in which initiator is of camphoroquinone and activator has diethyl aminoethyl methacrylate amine or diketone. So light activated composites are basically done under UV or halogen lamps. When the UV or halogen lamps are projected onto the composites, what happens is the camphoroquinone initiates the reaction and the diethyl aminoethyl methacrylate amine diketone activates the curing of the composites, and then the composite is cured. In the next video, I will just add upon the chemically activated composites and light activated composites furthermore, because they play a major role in both the clinical life and as well as in your university exams. So I will just add few more points to them and few more pictures, and then let us see in the next video about C factor, the configuration factor, which is very, very important, which can be asked in the form of short notes, and it's a must to write them in the essay also. So it's very, very important. In the next video, we will sum up all the other points related to composites which are very, very important for the university exams. Okay, thank you so much. Let me know if you have any doubts in the comment section.